Peace be to you all. Assalamu alaikum. This is Omar Abdul Malik, physician assistant slash associate and health educator. So, for those of you guys that don't know me, I've been a PA for a little more than 20 years. I currently work as a hospitalist. Been doing that for the past several years. So, I wanted to speak briefly about the concept of medical ethics within the healthcare paradigm. And obviously, with some of the hot button issues that are going on in the news, obviously the COVID-19 pandemic, but also the abortion issue in some of the southern states, it's going to be important that those of you all who are planning on careers in healthcare become really competent with your understanding of what constitutes good healthcare ethics. And those of you all who are new, either students now or young clinicians, and even experienced clinicians like myself, still have to keep our good practices as far as healthcare ethics is concerned. There is something called the HIPAA Act. So the Health Information, it might be Health Insurance Portability Act and Accountability, or Health Information Portability and Accountability Act of 1996. So this was really dealing with information that was between providers, what information could be transferred from patients. So if somebody were to ask for a consult, could you send that information to another provider with or without the patient's permission? It covered things like that, and then who had access to a patient's information. So there was a question about if an employer wanted to know the vaccine status of one of their employees, were they covered by the HIPAA Act? And the answer is no, because the HIPAA Act deals more with clinician to clinician kind of interactions. But your employer has the right to ask if you're vaccinated or not. They can deny you employment. If you work for yourself, they can even deny you. They don't have to use your services. For instance, if you're a chef and you do catering, even if you've catered for a particular place on multiple occasions, and you say, well, okay, I'm not getting vaccinated, that entity can say, well, we're not going to use your services if you're not vaccinated. They have the right to do that. Your employer, like my employer, could say, well, I want all of our people vaccinated. If I say, well, I'm not getting vaccinated, so, well, you can't work here anymore. I signed an at-will contract. So they have the right to ask that without breaching your confidentiality. Ethical, I think some of the things that we're seeing that are being implemented now as far as the vaccines are concerned, there is, it's getting a bit more invasive, and I think a bit more control is at least attempting to be exercised over people who are either not wanting to wear a mask and or not wanting to get vaccinated. That's a topic I think I want to save for another video. But in terms of healthcare ethics is concerned, those are things that you're going to really have to educate yourself about. There's a course I took way back in PA school called medical ethics, and I couldn't stand the course because it was 2 credits, and then 2, it was a lot of work. We had to attend lectures, and we had to break out into study groups and study, discuss case studies dealing with healthcare ethics. Then we had to write a paper. So it was a lot of work, especially if you were doing rotations and studying for your exams. But I'm glad I took that course because it really helped me understand the concepts of healthcare ethics. I'll do a more in-depth video about what constitutes healthcare ethics, because it really is a course and a separate specialty unto itself. I'll do this in the future, Lord willing, inshallah, because there's different principles and guidelines dealing with that. Some of the other things that you may see in ethics is things like competency. Can a person advocate for themselves? When I'm doing an admission on a patient, one of the things in my assessment, I look for things like code status. So is the person a full code, or the modified code, or do not resuscitate DNR? Then this has got to be confirmed with the patient if he or she is deemed competent. So are they alert and oriented times 3? Do they know who they are, where they are, and when it is, what day it is, things like that. And they can say, listen, I do not want to be resuscitated. Versus the person's obtunded. They've had some kind of brain damage or something, or they've been put under because, with medication because they've been intubated. Well, this person's not competent to advocate for themselves. So then we've got to get an emergency contact, whether that's a next of kin or somebody who has been assigned a contact. Some people have their like wards of the state, that kind of thing. Then things like restraints. If a person's pulling at lines or tubes, they're trying to pull their trach tube out, which I've had patients do, which is horrible. They pull out the tracheostomy, so it's a self-decannulation. They're pulling at the PICC line and things like that. Did they have to be restrained either with pharmaceuticals or actual wrist restraints, or because they're now a danger to themselves? That's an ethical situation. I've had, when I worked in outpatient clinic, I would have, people calling my office asking questions about my patients, like, what is he going there? What is he coming to see you for? I found this medication in his drawer, and I did some searching on it, and it's for this particular disease. Does he have that? What's going on? And he said, well, I can't tell you that. Well, I'm his best friend, or I'm his family member. I have a right to know, or he lives with me, or he's a partner. I cannot divulge that information if my patient is not given permission to divulge that information. There are also situations where things may even come into conflict with your particular beliefs. I'm for parents. I'm a very strong advocate of parents knowing their child's business. My wife and I've got 4 children. 2 of them are young adults, but I still want to be in their business. The oldest 2 are 21 and 19, but they live with us, so I want to know what's going on with them. But they don't have to tell me. So I had a situation many years ago with this, it was a 16-year-old girl who was getting an HIV test in my office. So I asked the mother to step out, and the mother was like really upset with me. She's like, wait a minute, well, I'm her mother. I have a right to know. I said, well, actually, that's true, but legally, no. You can't. You can't know what the results are. So I did the test on the girl, and then the mother was like, well, what were they? I can't tell you that. That's between me and your daughter. Your daughter can tell you, but I can't. Legally, I cannot give that information to you. So to me, that might be unethical, but it would be illegal for me to give that information.